Pulmonary embolism. It is blockage of pulmonary artery or its branches by the embolus. Embolus may be blood clot, tumor, fragment of fat or air. Blood clot is the most common embolus. Here is three major cause of blood clot: hypercoagulable state, venous stasis, vessel injury. These three is known as Vercue's triad. Blood clot develop most commonly in the deep vein of the legs, known as deep vein thrombosis. Physiologically, body attempt to break out the clots. Fibrinogen breakdown into its product in blood. So life finding is positive D dimer. Also, USG shows presence of clot in deep vein of the legs. Clot dislodge and migrate to inferior vena cava from the extremities and goes to right atrium of the heart. From right atrium goes to right ventricle and lodge in pulmonary artery or arterioles. Here is a small embolus may not cause any symptoms, but large embolus cause sudden and severe pain, and pulmonary saddle embolism may cause sudden death due to blockage of pulmonary artery, increased pressure in pulmonary artery, and that increased pressure in right ventricle. So echo have increased right ventricle size and decrease right ventricle function. Life finding is increase brain natriuretic peptide. Right ventricle strains increase the right ventricle workload and decrease the coronary artery perfusion. Life finding is increased troponin and increased lactate. Due to increase in right ventricle pressure, expansion of the right ventricle and leftward shift of the right ventricle septum, and that decrease the left ventricular filling in the diastole, decrease filling, so decrease cardiac output, impaired heart filling, also called obstructive shock. So decreased cardiac output leads to insignificant organ perfusion. In skin, vasoconstriction in extremities, blood travel to the vital organs, so cold extremity finding. In kidney, decreased GFR, oliguria. In heart, decreased coronary artery perfusion, myocardial ischemia. In brain, cerebral hypoxia, progressive loss of consciousness. Heart tries to compensate by the increase in heart rate, so also tachycardia. Here is expansion and increase in pressure in right ventricle, so increase pressure in the systemic venous system, increase the pressure in the capillaries that draining parietal pleura. Pressure driven fluid leakage into the pleural space leads to pleural effusion. Pressure increase in systemic venous system increase JBP and also cause pressure driven peripheral edema. Due to pulmonary artery blockage, decrease perfusion to the lung parenchyma. Here is ischemia of lung tissue distal to the clot, finding dyspnea, pleuritic chest pain, and X-ray finding is Hampton's hump. Sometimes lung infraction from ischemia occurs. Here is inflammatory cells migrate to the site and release cytokine, increase permeability of blood vessels, and that cause pleural effusion. Here is permeability driven pleural fluid leakage from into the pleural space, and there pressure driven fluid leakage into the pleural space. Due to decreased perfusion to the lung parenchyma, and here airflow and ventilation to the lung is unaffected, so ventilation and perfusion ratio is mismatched. Increase dead space ventilation, and chemoreceptor detect increased CO2 and decrease O2 signal to brain, increase the breathing rate. Finding is tachypnea.